Can we just talk about the fillers, ladies? Fillers are great. They make you look beautiful. It's great. But we're the dentist trying to make your teeth look good, and you say to us, I can't see my teeth because you have 2,000 pounds of fillers. Get a little less fillers so I can look at your teeth. Fillers are great, but up to a point.
Yeah.
You're killing me.
Yeah.
The eyes are a measurement of the canines. For the dentists out there, are you measuring interpupillary or are you measuring intercanthus? The measurements are different. So I urge you to be careful of what you're measuring to get that canine to canine position. Tell us about the new program that we're using called Smile Cloud.
It's a program that allows us to digitally design in not only two-dimensional, which is what we were limited to before. Now we're taking that and we're making it into the three-dimensional blueprint for that patient. So we take our intraoral scans, we could take the CBCT scan, we can merge them together with the photos.
And the photos,
so now you have
and the smile preview.
And the smile preview, and you have a digital avatar now, right? And you're able to more precisely and accurately deliver those proportions, shapes, sizes into the patient's mouth using this program.
Talking Teeth with Dr. Dean.
Hello everybody, welcome to Talking Teeth. How are you? We're here from London, not really, from New York City. And we're talking teeth. Everybody, we're here with Becca Morris, Mr. Reese, say hello Reese, and Dr. Ari Koutsoubis, who's one of our partners here at New York Smile Institute. Today's topic is digital technology, how it's changing, what we're doing, how it's evolving into AI components of dentistry, and how the digital world is really impacting our daily lives as doctors, as patients, as dentists, to really provide the patient with the ideal physical space of the teeth and the smile that really fits their face. The hardest thing in dentistry to do today is to pick the right teeth for every patient. How do we pick the right size tooth for you? How do we do that? A lot of people have lab technicians, a lot of people have digital designers, a lot of people have softwares to do it with. How do we do it here at New York Smile Institute at FMR? I think we have the fastest, most efficient way. We have new technology that we've just signed on to last 4 or 5 months. And to me, I think this is the most efficient way to get things done for our patients to really look the best that they can look. And for the dentists, you're going to hear some new technology that we're using. For the patients, you're going to hear the way we're using it and why it's really important. So let's get started. 5-6 years ago, we had a whole influx of different softwares that basically was started from Homeland Security about 12 years ago, and that was called facial recognition. When you go to an airport now, they're taking your picture. That technology was available 12 years ago, but they didn't adapt it. Only the CIA and the FBI had it. Now it's in every airport. It's in some of the banks have it. A lot of institutions in universities have facial recognition. And the way that works has to do with eyes and nose and ears and mouth. It's a general topography of your face. Obviously, everybody's different except for twins. Twins have a problem with facial recognition.
I never thought about that.
They can't really tell the difference.
Wow.
So it's an interesting part of the twins. So just like your fingerprint, your eyes, obviously the retinal scans have been around for many, many years, but not really used in the common day-to-day for patients. What we did about 8 years ago is we started researching the facial scanners. There was facial scanners with phones, with computers, with different high-tech lights and all that stuff, but it was not really applicable for day-to-day dentistry. It has to do with time. For a patient's perspective, I can't facially scan you for 30 minutes. It's ridiculous, right? It's got to be something really, really quick. So time is a big component, but with time, the quality gets, quality is not as good because you're only taking 2 or 3 second shots. But the new technology now, it's actually very fast. It's very quick. There's no intrusion for the patient. They're just sitting there smiling and the camera's rolling and the pictures are taken. So for the patient's perspective, it's not a problem.
I'm curious as to, you're just working on the mouth. Why do you need the whole face scan?
That's the whole question. Thank you, Becca. Why do you need the face if you're making teeth? Think about it. Why do I need a face to make teeth? Well, guess what? Your eyes and your nose and your ears is part of your face. And that teeth, that whole smile is literally 1/3 of your face, sometimes half of your face. So if we make the teeth beautiful, perfect, and we put them into your face and it doesn't fit your face, you may have seen that. Like your lips don't really fit your face. Those glasses don't fit your face, right? Everybody goes to get their glasses done. You can't have the same glasses that I have. My face is longer, her face is shorter. Different lenses work with different people.
Even accessories, earrings.
Everything works differently with everybody. You have to work and accent your face. Your color of your hair, the color of your eyes, the way your forehead is, the way your eyebrows are. Well, guess what? The teeth are the same thing. If the teeth don't fit the face, and I give you perfect teeth, and in the mouth, and it doesn't look like your teeth, they look too small for your face. Some people need a wider arch, some people need a narrow arch. So the size of the teeth is so proportionate that we've almost figured it out. I'm very, very close to figuring this out. That your eyes, everybody, go on Google, your eyes, the ball of your eyes is 21.4 millimeters. Everybody's eyeball is exactly the same in the whole world. Human, I'm talking about. But what is different between her eyes, my eyes, and his eyes, and any other patient? It's the tissue around it, right? You have different ethnicities, have different textures, different types of skin that's on the eye, the area, different eyebrow, different lashes. That gives the appearance of a different type of eye and the size of the eye. The distance of the eyes, the interpupillary distance of the eyes, is different for every patient. So, if the eyes are different, then the smile has to be different. And we know this from the denture principles, 1950, 1960, that the eyes are a measurement of the canines.
Correct.
Now, for the dentists out there, are you measuring interpupillary or are you measuring between the
Canthus.
pupils or intercanthus? The measurements are different. So I urge you to be careful of what you're measuring to get that canine to canine position. So if we know the eyes are the same size for everybody, but the positioning is different, that's going to change the size of the teeth.
That's so interesting.
Now,
So you use all these ratios to
so
calculate.
the AI.com,
Yeah.
the AI stuff that we're working on right now is allowing me to put in the numbers of the face, the numbers of the nose, the numbers of the ears to come up with the right size teeth. Now, most of us do this with the programs. We look, we check, we look, we check, we look. If we can have an algorithm that we can plug in the eyes and the nose and the ears and the commissure and the lips and the forehead, and the answer is going to be 10.65 and the width is going to be 8.3 because of that face. Now what we've developed is a digital analysis of the face to give us the right size teeth.
But then there's a caveat.
There's always a caveat.
Always.
That may be a nice calculated proportion, but the lips, and everyone with fillers,
Yep.
maybe someone lost weight, maybe someone gained weight.
Okay, can we just talk about the fillers, ladies? Fillers are great. They make you look beautiful. It's great. But we're the dentist trying to make your teeth look good, and you say to us, I can't see my teeth because you have 2,000 pounds of fillers, and you tell me to make your teeth, bring them out. The lady can you bring my teeth out? No, your lips are out here. I am never going to get the teeth that far out. Get a little less fillers so I can look at your teeth.
All
So,
of them.
fillers are great, but up to a point.
Yeah.
Moderation.
You're killing me.
Yeah, less and more.
So say again. Say what you're saying.
No, so like we said, lips, the cheeks, you have all these differences in the tissue that you were describing before, right? Everyone has their own personality, not only, literal personality, but also facial features that, okay, maybe the proportion is perfect compared to their, their interpupillary or the ear, the nose, but then it still doesn't fit. So then you got to make changes, whether it's in the mouth, the temporaries, or, with the other programs, so you can actually, pick out the size from a visual perspective and say, okay, this looks better, even though it's not the calculated size. beauty is in the eye of the beholder, or the dentist in this case, right? So it's up to us to have a good artistic ability too, to say, you know what, I think this fits your face better than this golden proportion or calculated proportion or whatever.
Right. But the take home message, I mean, for me, I've been trying to, I'm always in a mode of, is there new technology that I can use, number one, efficiently, and is there something I can teach? Because if we're the only people doing it, it's not a value to the community,
Of course.
in dentistry community or patient community. So we're always in the mind frame for me is the technology works. I know it works. Can I teach it? Is it for everybody to learn?
So speaking of that, obviously being based in New York City, a lot of dentists' office have this technology and offer it. When you're looking for a new dentist, how would a patient find that out, that the person they're going to is using all of these things and the ratio and the algorithm and the scanning?
Well, that's new.
Yeah.
All right, so that's really on the forefront.
Yeah.
We're talking about things that are on the forefront. What I would definitely have the patient ask, do they have a digital scanner?
Okay.
And do they have a facial scanner? Those are things I would say right now, I would say 10% of the population of dentists have that.
Oh, wow.
It's still on the early curve.
Oh, so we're spoiled here.
We're spoiled here, yes. We have all this great technology. I would say around the world, it's less than 5%
Wow.
that people have this
Oh,
technology.
wow.
One, because it costs a lot of money. Two, they have to be good enough to actually use it and to make it work and implement it. Because implementing, look, technology is great. You got to implement it, meaning the server, the back computer, everything's got to be implemented to actually make it work. Then you have to have a printer to give you the final product. So not every office can afford that system. So right now, I would say in the world, it's about 5% of the dentists have it. And I would say in US, maybe 10%. And I would say maybe in New York City and Miami would be 20%.
Now, if you are using these new technologies, does that increase the cost for the patient?
No. So one of the things about, I believe, and again, this is my belief, some people do charge for these things. They'll charge
wow.
digital analysis $2,000,
Oh,
right? I feel my job is to get the product to you, the patient, as fast as possible and most effective as possible and looks the best. Whatever I'm using to get that is my personal achievement and my personal will that I want to have all these things to get the answer correct for my patient so I don't have to waste time. So I'm spending money on technology so I can save time. Now,
amazing.
what's happened in literally the last 6 months is we have a new 3D facial scanner, which I will share with you. And I'm going to put that together with the joint and the CBCT scan, which is a scan of the skull, which is now we have skeletal measurements. So you have facial measurements,
Right.
eye measurements, and then skeletal measurements. Because we want to know where the bone is, where the teeth are, where the gums are.
It makes sense, yeah.
Right, so you're putting all these things together,
Wow.
and then I give this great technology to this great guy, who's amazing. I found this guy, he's Dr. Ari Koutsoubis. Koutsoubis. My name's Vafiadis. My mother's maiden name was Koutsoubis.
Oh my gosh.
So
Chance.
somehow we're related. I don't know how, but we're related. He was in Tufts University, first year dental student, saw my lecture and has been following it from ever since. He's about 4 years out now. He's doing great dentistry. And now he's taking the digital technology that I know I have and I'm giving it to Dr. Ari. So tell us about the new program that we're using called Smile Cloud.
So Smile Cloud, yeah. It's a program that allows us to digitally design in not only two-dimensional, which is what we were limited to before, right? We had a two-dimensional quick preview, simulation.
Smile simulation.
Smile simulation
Which
for
works
patients
great.
to see. And it works great. Has its limitations though. Now we want to take it one step further. How can we make that two-dimensional into three-dimensional real life in the patient's mouth? Because it doesn't always translate. It may look great in the photo, but it's not always the same. So now this program has some AI features in it as well. So it allows you to it gives you some estimated proportions that you can tweak, obviously, which is what I was kind of mentioning before, to like the lips and the face and everything. And now we're taking that smile design, two-dimensional, and we're making it into the three-dimensional blueprint for that patient. So we take our intraoral scans, we could take the CBCT scan, we can merge them together with the photos.
And the photos,
so now you have
and the smile preview.
And the smile preview, and you have a digital avatar now, right?
Right.
And you're able to more precisely and accurately deliver those proportions, shapes, sizes
Right.
into the patient's mouth using this program.
Right.
So what I like about it is that the library of teeth that it has is very versatile. It's not just, 2 or 3 or 5, different same shapes that sometimes programs can't really build off of.
Yeah.
This has a very large library that fits all different types of people.
And another thing, technically, a technical nuance that patients should know and dentists should know. We have taken the last maybe 100 patients and taking those sizes of your teeth and everybody's teeth that we finished, because the teeth look great, right? So we've taken those sizes and we can import them into the library. So now I have the regular digital library from the AI program,
always learning.
and then I have the new cases that we've done already. So we love our cases that look beautiful, and they all look different. They don't look the same.
So I remember when I went through getting my veneers, you guys showed me what I would look like. You gave me a photo of
Right,
myself.
simulation. Right.
Do you see that you have a lot more acceptance rate of patients who are signing up to go through this process because you can present them something like that?
There's the answer is yes, but it's also with simulation, like Dr. Ari said, it's a 2-dimensional photo. So people usually say, "Wow, this is great," and they like it. And if a person says, "Wow, this is great," I'm not going to show them anything else because I got them. They said hello. They said thank you. They're good. They're ready to go. Sometimes there's a proportion of patients say, I'd like to see it more real and more 3-dimensional. And I'll go ahead and call Dr. Koutsoubis and I'll say, hey, Dr. Ari, go ahead and do this so the patient can see it really in 3-dimensional dye.
Avatar you're talking about.
So that's a little bit more if they really ask for it.
Right.
So for the patient's concern, remember, you're coming to an office, you want a beautiful smile, you want to look and see what it's going to look like, approve that, and then you want to deliver the provisionals. Our job, our typical time, and I'm talking to the dentist now, you used to use a wax up, you used to maybe use some kind of digital smile design overseas, you did some kind of digital software, and then you got the model back. As dentists, we have to deliver this model to your mouth. If that's a millimeter off, we're no good. If it's a 0.5 millimeter off, it's still not perfect. What I'm trying to get to, the wax ups were 2 millimeters off. The digital smile designs were like really close, better than what we had, but not 100%. We're into about, 20 cases right now, and they're dropping in for us, like they're just dropping in. So our time, again, is saved.
Yeah.
Your job, you're as a patient, you just want to look good, right? I want to look in the mirror, it's got to look perfect.
Yeah.
So we always gave them a perfect view. It just took us longer to get there.
Yeah.
So the digital, the AI, all the component, everything he's designing right now, remember, what we do at FMR is we test these products. I'm not going to tell a dentist to go buy something that we haven't really, really, really tested, that I know when I put my recommendation to something that it's going to work. And no one's going to call me and say, hey, this doesn't work. Like I said, it can't just work for us. It's got to work for the masses of dentistry. It's got to work for the masses of the patients. And I'm not going to put my recommendation on something unless we've really worked out the kinks.
Yeah.
And I'll tell you, hey, this is working. Like, I know it's working. And you're going to call me up and say, hey, what happens if I do that? And you may make a mistake. And then I can help the dentist get to the end result.
Do you have any, maybe Dr. Ari, some specific case you can talk about where you've implemented technology like this?
Do we have a case?
Oh, gosh.
We have.
That's a
Buckle
great
up.
question.
We have a couple of different. They all range from.
They're all different.
They're all different.
But the latest one,
one's coming up.
it's beautiful.
Oh, I can't wait.
It's the technology's beautiful. The visuals are beautiful. We're going to put some of the visuals up on the podcast. This case, if we can do this case, it's going to change a lot, because this is an extreme difficult case. So not just a smile makeover. That's easy to make look good.
Yeah.
Those are easy level 1 cases. Anybody can make that, say, look, my technology works. Well, that's for the easy cases.
Yeah.
Can you use their technology on the super hard level 10 cases? Because then you got a software that works.
Yeah.
So I'm very passionate about this.
I can see your guys'
Because-
eyes lit up.
No, because everybody can do the level 1. The level 1's a veneer case. It's easy. It's like your case. Put a smile. It looks great. It's going to fit. But the other cases are complicated. Implants, crown lengthening, surgery, missing teeth,
Jaw movement.
jaw movement,
Yeah.
left and
wow.
right. I mean, there's a lot of stuff. So this is level 10 cases that we're working on that are extremely difficult. That if I can get this software to work on this, hey, we've changed the game.
Wow.
And for dentistry and education, it's a game changer. If we can get this technology to work the way I see it, remember, my vision is very different than the average dentist. My vision is, how do I get this working super fast, super efficient, clean, beautiful, predictable, and then I can teach it. If I can't teach it, it's worthless to me, because then I can't be the only one doing something. It doesn't translate.
Yeah, super exciting stuff.
What's your take on it? What were you doing a year ago, and what are you doing now? What has changed?
Well, one, now that I've been doing more of the cases, whether they're smile design or just changing the bite and just kind of doing the whole rehabilitation type of cases, I've been really trying to hone in on making sure that it works, one, right? So I've been using it more, just more on my own. Like, you know, you just started kind of seeing what I'm doing with it, and you're like, let's do this. Like, see it, you see the value in it. So now we're trying to bring it to that level, to those level 10 cases, like we're saying. But the basic ones, like we were saying, from last year to now, I've been doing it more, and it's becoming more predictable, like each time.
And we did Evan's case. We did one of the students at NYU.
Yeah.
We did his case. I'll show you his before and after. I'll put that up as well. That was one of the first cases.
That was
I
one
think
of the
we
first cases that we
did.
did.
And that was a year ago. So
Right.
from there to here, it's been changing.
So yeah, and then, you know, it's just trying it out. You know, you just have to be open, and you have to teach yourself. Sometimes you have to take a course, but you got to spend the time to learn it.
course.
You know, it may be available to everybody, but if you don't spend the time on it, then it's useless.
Right. And the other
So-
part of digital technology, like Dr. Ari said, you have to use it. A lot of people buy scanners and they don't use the scanner. And it's sitting in their office, and it's like, they're kind of fumbling with it.
Right.
And as a patient, like, if you have it, like, I want you to use
Right,
it on
of
me.
course.
And, you know, give me the best result you can. So, so digital technology is changing. I think it's really exciting where we are. We're definitely going to share. Any questions? Any other questions you have? I think that's it.
Yeah.
All right. So we'll see you soon. Thank you for joining us today. And the next episode, sorry. Great to see everybody. We'll see you on the next episode. Talking
It's
Teeth.
Friday,
Thank
Talking
you, Doc.
Teeth.
Thank you,
Thanks for
Doc.
having me.
Thank you. Thank you, Reese.
He was napping.
Thank you, Reese.
Yay, Dr. Reese.